Thanks, John. Great intro. Let me make sure I got the logistics right here, the slides and the clicker. Yes. Okay, and I just go down. Okay, perfect. Good afternoon, and thanks, John, for inviting me. I think it's a great honor to be here. And basically, I'm going to tell you about STAR. And so what is STAR? STAR means, or stands for Strategy to Accelerate Research. And it's really the research program from the CMT, the CMTA being the Charcot Tooth Association. How many of you have heard about STAR, familiar with it? Okay. About half. So I will go through the whole history and explain to you what STAR is, because in a way, the successes we've had are a great part about what we're doing and why we're doing it. So what's interesting is STAR was born here in Palo Alto. It was born about 8 years ago, just 2 miles from here. And what happened 8 years ago, I mean, Elizabeth and I were just starting to get involved with the CMTA, and the board came to Stanford, to Palo Alto, and we spent 3 days really thinking about our strategy. How are we going to devise strategies to bring new drugs to market, to find cures for CMT? And we came up with STAR. And I will explain to you a little bit what STAR is and where we're at, but there's basically 2 basic ideas behind STAR, if you try to remember. The first idea, which is very interesting, is we know the cause of CMT. Now that might sound like a detail, but if you think about in fact, most of the neuromuscular or neurological diseases, the causes are either not known or are very complex. For CMT, the big breakthrough was in 1991, where the gene called PMP22 was discovered. PMP22 is the gene that creates, it's at the root cause of CMT1A. And then ever since, many other genes have been discovered that are linked to CMT. I think we're up to about 90 genes now. And with all the progress about gene sequencing, basically it's almost every month we find new genes. But what's very unique about CMT, in most cases we know the cause. So it's probably something you experience in your life. When you have a problem with your car or you have a problem with your computer, and you go to see someone to get it fixed, and then the problem goes away, right? So you cannot reproduce it, and because of that, people cannot solve it. So the big eye-opening moment for us, and for me in particular, was that we can reproduce CMT. And as an engineer, you know that when you can reproduce a problem, it's halfway solved. If you cannot reproduce a problem, you'll spend all your time trying to figure out where the problem is, where it is. For us, we know exactly where it is. It's a big chance we have with CMT. Remember that. And the whole STAR program is based on this. We know where to look. We know which part of the car is broken. We just have to figure out how to fix it. Does that make sense? Okay. The second part, which is very important, is we realize that the way most nonprofits and organizations push new drugs or discoveries is very different than how businesses work. And it's kind of a random process. Most foundations basically look at grants every year and pick the top 3 grants to fund, right? So it's a bit of a random process. If the grants are good, you get good results. If the grants are not that good, you don't get any good results. So we really decided to bring a business approach to this whole research. And I explained to you a little bit that a bit later, but there's basically 5 basic business principles that we applied. And we didn't really invent this. Other foundations had started doing that, and we learned from them. And I think it's a big part of our success, so I'll spend a little time talking about this. But first, let's circle back to what is STAR and how do we use the fact that we can reproduce the disease. So the basic idea, and I'm going to throw a few buzzwords out there and I'll explain them, but the basic idea is we can reproduce the disease at the cell level. It's called an assay. So an assay is basically a test, and it's basically some cells in a dish that have CMT. So now we've created CMT in a cell, and it's very inexpensive, and we can create thousands of those. So the next step, we do what's called high throughput screening, HTS. And what happens there is we create thousands of those little test tubes that have CMT, and we can test thousands, tens of thousands, millions of compounds and see which ones have an effect on CMT. So it's a bit of a brute force or carpet bombing approach, but because we know the disease, we can do that. Most other diseases cannot do that. So that's the second step. And the third step is we can create what we call lab models, which is in our case mostly mice and rats that have CMT. So we can take the most promising drugs that came out of the screening and test them in animals, which is a much better test, of course, than at the cell level. So think about it as a funnel, where we start by screening. We've actually screened 3 million compounds to date on CMT1A. Think about 3 million compounds. And we bring it down to the few ones that are the most promising, test those in mice and rats, and then over time then test the even better ones into humans. So we've created this whole funnel. It's taken us years, but we have the assays, we have the cells, we have the rats, we have the mice, we have the high throughput screening partnership with the NIH in Washington. So over the last 8 years, we've created all those assets that really help us create this funnel and really figure out among all the compounds that are out there, which ones are potentially helpful for CMT. Okay. Now let's go back to the second big idea, which is the business principle. So those things will sound obvious to you, but what's interesting is most organizations don't always do that, and those are difficult to do in the world of academic research. The first is to start with a strategy. Just describe our strategy. So it's not like we are randomly trying to pick good projects. We decided this is how we're going to solve CMT. We're going to create those assays, we're going to test them, we're going to create those animals, and this is how we're going to really create this funnel to find a solution. This is our strategy. That's what we've been doing for 8 years. That's what we're doing for every CMT type. We haven't changed. Okay. And then we're going to pick the best people to go do it. So we didn't wait for people to come to us. We'd say, who are the best people to create assays? Who are the best people to do screening? Who are the best people to create those animals? We went to them and say, can you please work with us? And then they were happy to work with us. And then basically we create a network of the best researchers in the field that's relevant to our strategy. Okay? Number 3, accountability. Again, that sounds obvious, but it's not always easy. You know, when things don't work out, we hold people accountable. There's been cases where we actually, when it didn't work out, we just moved on and worked with other people. Not a very common thing in the world of research. And we've created a sense of accountability, which is very important. Collaboration, another interesting one. Researchers collaborate naturally, they share papers, but they also compete a little bit against each other because they compete for the same grants, the same government money. So they don't always share everything, and it's not a natural thing to work together. So we're really forcing collaborations. It's very important for us, for our researchers to work together, and it's made a big difference for us. And the last one, probably the most important, is partnerships. We cannot do it alone. I mean, do you have any idea how much it costs to bring a drug to market? Let me hear some numbers here. 10 million? It's like an auction.
750
million? Yeah. So the numbers are all over the map, but in average, it's at least $200 to $300 million to bring a drug to market. And that's the best case, because if you count all the drugs that didn't make it, then it goes to $1 billion, or $1.5 billion, or $2 billion. Okay. So do you think we have this kind of money? Okay, so how are we going to do it? We're going to work with people who have this kind of money. So the notion of partnerships is really important, because what we do in our strategy is help other people come on board with us, because we cannot do it alone. Okay. The way I like to explain this is, remember those little fish that kind of stuck on top of big sharks? Okay. And kind of pilot them or guide them? That's kind of where we are. Our role is to work with big companies that have a lot of financial interest, a lot of financial resources, and help them be successful bringing drugs to market for CMT. So everything we do is not doing everything ourselves, but facilitate the research and bring drugs to market for CMT with partnerships. Does that make sense? All right. So basically, this was written 8 years ago, and it really hasn't changed. Okay, it's hard to do, but it's very important to have, to stick to the strategy and principles that we laid out a few years ago. Now, where are we? So let's start with this little blue square here. To give you an idea, last year, the STAR initiative, we actually had 35 projects that we funded. We spent over $2 million on research. But what's interesting is this is 10 times more than when we started. Okay. So this STAR initiative, you'll see, not only has delivered good results, but it's really grown tremendously. And success breeds success. So this costs money. We're raising more money than we did 10 years ago because people are encouraged by what we're doing. We have more credibility, and then we're able to reinvest this money in more research, which creates more credibility and good results. So I think there's a virtuous circle that started by the STAR program. By creating results and accountability, we're able to fund the right projects, we're able to raise more money, et cetera. Okay. And I don't want to go too much into the fundraising part, but it's critical. But I want to really emphasize how important the community is for fundraising. I looked at the data just a few months ago. At least 80% of our funding originates through the community, through you guys. So big thanks to everybody. I mean, the community is fantastic. CMT is a fairly common disease, and hundreds of thousands of people have it around the world. And there's a lot of people who help us fundraise. There's wealthy people, there's people who are community organizers. So the community has been fantastic. And everybody has a role to play here because, again, the more money we put into research, the more results we get. The more results we get, the more money we put into research, and we're going to continue this circle. So thank you, everybody, and everybody has a role to play here. Just a couple words on the organization. We have two major advisory boards. One is the Scientific Advisory Board, which advises on scientific projects. And when we started, that's all we had. In fact, it was half as small. All we did was science. Okay. But now we have another board, which we call the Therapy Expert Board, which is the board that tells us which projects can be taken into therapies. So another buzzword you're going to hear is translational. It basically means how you translate science into therapies. And the good news, we are at this junction now. We don't just do science anymore, but we do science and try to bring science into therapeutic solutions. And that's why we've created this Therapy Expert Board, and we've grown it, and it's become a really important part of what we do. And we spend more of our time, money, and resources on therapy-focused projects versus pure science projects. Okay? So where are we? As you know, there's many types of CMT. CMT is the most common. It's also the one we are much further ahead than the others. And let me give you a quick progress report on CMT 1A. As I mentioned, we've screened over 3 million compounds with many partners. And the bottom line, we have two very exciting partnership and projects. There's others, but I want to focus on two. The first one is with a traditional pharmaceutical company called Sanofi Genzyme, and they have about 30 people working on this with us. They've screened over 2 million of their compounds, and they've found 4 compounds that are very promising. So right now they're going through the process with our help, are going from 4 to the top candidate and a backup. So this will probably take until next summer. And if those 2 compounds are promising, they will go through a major milestone and kind of step up the game by a factor 10, where basically they got into the heavy, what John described, all the preclinical work. You have to remember this, not only drug development is expensive, but it gets more expensive the closer you get to the goal line, like by a factor of 10. So the work we're doing right now, I mean, launching STAR, we were able to launch STAR on less than $1 million. Now we're spending several millions a year. The pharmaceutical are doing that, but once we get into the early clinical, the preclinical, and the clinical, it multiplies by 10 every time. So they have major milestones to make sure they don't go into those phases if they're not sure it's going to work. So some of those, there's a big milestone like this with one of our partners, probably next summer we're working on the timeline, and we're working with them very closely to do all the testing necessary to make sure it's a successful milestone. So as one of our researchers said, if we pass this milestone, we'll be in the big leagues. So it's both exciting, it'll be nerve-wracking, but I think we're doing everything we can to be successful there. The good news is they have 4 families of potential drugs, so there's a lot of things to work with thanks to this funnel we developed over the years with them. Okay? So that's the traditional, what's called sometimes small molecule medicine, which is really the basic pills. Now there's a whole branch of research in medicine which exploded in the last 20 years, which is biotech and gene therapy. And interestingly, the other exciting program we have is with a biotechnology company. And what they do, it's totally different. Now they don't just have a little compound that goes all over your body and try to counter-effect the effect of PMP22. They go straight to the defective gene. And again, this is very complicated. I don't understand half of it. A lot of people got Nobel Prizes out of it. There are a few drugs on the market now that are really coming out using those technologies. But the idea there is to create a little piece of DNA or RNA that goes right into the outside of the cell and basically counter-effects the effect of what's happening in the cell and that is wrong because of the overexpression of PMP22. So very complex mechanism, new technologies, but it's very exciting because it's like we have eggs in completely two different baskets. It's very different technologies. And what this company did is they developed this little piece of DNA for the CMT rat that we have, and we saw really good results on the rat. It basically stopped, even reversed CMT1A. So now they're developing a human version of this. It's probably going to take them probably until next year. And once they have the human version, we'll start testing in some of the tools we've developed. If that's promising, that potentially we could test into humans. So very exciting developments. Still a lot of work to do, but we're a long ways from where we were 8 years ago, where basically we just had basic science. Okay. Now, the other thing we're doing now is we're trying to take everything we've learned on CMT1A and to really advance also progress in the other diseases. So in the projects I showed for last year, actually the majority were not 1A, they were other diseases. We're basically now working on 1B, 1X, 2A, and also we just started on CMT4. And the idea there is to, same approach, we create those assays, the animals. There's also some specific genetic engineering projects going on there. So it's a lot of details, but I suspect, and we're going to have a big review next month with our researchers, and we're going to have disease-specific strategies and disease-specific funding. And I think we're going to start seeing some progress in the other diseases, really learning from what we learned in CMT1A. Now, the challenge is they're all similar, but they're different. CMT1A is a duplication of a gene. Most others are, they're not duplication, they're basically mutations, and they're very complex mutations. So there's a lot of basic science still to be done in the other diseases, but especially, I think 1X is for the one that has the most promising stuff after 1A. And we've had some good results establishing some of the assays for 2A and 1B. So there's a lot of progress in the other diseases, and we try to learn from everything that's going on across the board here. Okay. One other element I want to emphasize is one of the most challenging and element of drug discovery is how do you go from animals to humans? That's where most drugs fail. They can be very successful in animals and they fail in humans. So we are using a stem cell technology not to fix the problem of CMT itself, but to create better tests. So now you can take skin samples from anyone with CMT and you can turn them into what's called iPSCs, which is pluripotent stem cells, and which basically are cells, they can become any kind of cells and turn them into either Schwann cells or neuron cells. So we can basically recreate human cells that have CMT, then we can use those cells in our assays in our animals. So now we think because of that, we'll have a much better test than with just the animal PMP22. Now we can insert the human element into our whole testing program. Okay? So we just started with that. We have a mouse now, a CMT1A mouse that has the human PMT gene in it. And those are the things that the partners really value in the relationship with the CMTA. Okay? All right, now here's the interesting part. And John mentioned it. All this needs to lead to clinical trials. Now, this is where things get really expensive, really complicated, really risky for a pharmaceutical company. So one of the most important things we can all do here is find ways to make clinical trials less risky, less expensive, faster for our partners. In some ways, I mean, imagine partner X has a list of drugs that are promising. If they think it's going to take 10 years of clinical trials or 2 years of clinical trials with 5,000 patients, they might do their calculation and figure out it's not worth it. So the cost and the risk of clinical trials could very well determine whether pharmaceutical companies will actually do trials on potential drugs. This is for the most important thing for us to understand and to work on. And again, John mentioned this, where Stanford is on the list. That's why we do all this work to prepare, because now we have all these drugs in the funnel. Very soon we're going to have to start designing clinical trials. If they're too expensive, too complicated, it might be an issue. So we all have a big role to play here. So we've created, there's actually an organization called the INC, Inherited Neuropathy Consortium, that we're part of, that's creating all those centers around the world that are really getting us ready. And what it means is the following. There's something called natural history. Because CMT is a progressive disease, we need to know the history so we can see when we try a drug how this history is affected looking forward. So if there's one thing everybody can help here is make sure every one of you that has CMT, everybody you know that has CMT is working with the Center of Excellence, working with the ANC, so we have your data, we have your history, because it'll be good for you because when we do the trials, you'll be involved, but it'll be very important because we need to have all this data, because the more data we have, the faster we can really go to a solution, the faster we can make the clinical trials, the less risky we can make them. So you can see a little bubble here, join the ANC contact registry. The URL is very complicated, so just Google that INC contact registry. It will take you right to the right page, and make sure everyone who has CMT, everyone you know, is on that list. And if you go to the Center of Excellence, you're probably already on there, but it's really important not only to be there, but to really help us build this database that will be critical to our success once we start testing drugs. One of the challenges about CMT, think about it, it's a slow evolving disease, right? So how do you know if a drug is working or not? We can't wait for 10 years. So we need not only to have this natural history, but we need to define what we call biomarkers. How do we know in 6 months if a drug is working or not? So we're looking at really strange things like this is an MRI of calf muscle, because the muscle mass decreases with CMT, so this is a better indicator. People look at your eyes blink, they'll look at skin biopsy. So that's a lot of where we're putting our research right now, to find those indicators, so we can really can tell whether the drug is working or not. And then there's all the scores that I'm sure some of you have been exposed to as well, that try to give objective measures of the level of CMT. It's a big challenge because it's a slow evolving disease, and we don't want to be in clinical trials for 2 years, because that might actually keep people away from clinical trials. So a lot of data, a lot of people involved, and then working on those biomarkers. So this is something everybody can help. Okay? And last but not least, I mentioned partnerships. This is just to really acknowledge our partners. It's a growing list, but you can see some really first-class names there, whether they're pharmaceutical companies, test areas, service companies. It's a changing list. But again, as I mentioned, we cannot do it alone, and our role is to really enable those partners to be successful in the marketplace. So I covered a lot of things very quickly. I hope it was helpful. I'm happy to get into more details now later in the questions, but I hope that, like me, you are full of hope, because it's been a long journey. We're not there yet. We made incredible progress the last few years. We've created amazing assets. And basically, personally, I know it's only a matter of time until we find a solution for my son Yohan, for you guys. Still a lot of work ahead of us, but we will get there. And thanks everybody for your help on this. Thank you.